Hello and welcome to Introduction to Medicines Management module PW1002. So hi, I'm Gemma Booth. You might remember me from the very first welcome day that we had over on Preston campus. Obviously it's been a little while since I've seen you all, so I hope you're all well. For those of you who can remember me, hi. For those of you who can't remember me, so my name's Gemma Booth. I'll be taking you for the medicines management module over the next 5 or 6 weeks. I'm a nurse by background, so I have got an interest in medicines management. I've also got an interest in anatomy and sustainability, so you might see me for some of the modules later on in the year, and maybe into your second year. So hello and welcome. So as I said, this is just a quick introduction to medicines management. I am going to do the introductory session between 9 and 10 on the first day. So I will be going through some of these other bits and pieces, but just in case you want to go back, have a look, see what the module's all about, I'm doing this recorded session for you so you can access it at any time. So here I am again. Hey! Obviously hair up today, but normally I've got my purple ends. So I've tried to make my little me. So you might see my little me pop up every now and then on different resources I produce. I just feel that because I'm not seeing you all a lot, it's nice to have that little personal touch of me popping up and going, hi! So as I said, it's the Introduction to Medicines Management, PW1002. I will be your module leader. So obviously my details are there, Gemma Booth, gbooth3@uclan.ac.uk. You can also get me on Microsoft Teams if you use the Teams chat function and just search for me. So then we can have a bit of a chat looking at that and going through if you've got any issues, problems, questions, etc. I'll also talk you through some of the other ways and some of the other resources that I've put on for you later on in this PowerPoint, and as I said, when we have our session later on. So I do have a telephone number which is in the module handbook. However, at the minute, because we are still home working because of the COVID situation, I don't actually have access to my telephone at home. So the best way to contact me is either through Teams or through email. And then obviously I can give you a Teams call if you want to talk to me direct, but that's going to be the best way to contact me at the minute. So as I said, this is the Introduction to Medicines Management. So the aim of this module is to introduce you to the principles of clinical pharmacology and practical medicines management as applied to healthcare. And it's also going to encourage your development of your numeracy skills. Unfortunately, this does mean that during the module we are going to be looking at maths, and I know everybody hates maths, but it is one of those things that if you are dealing with medicines management or you're dealing with patients in any way, shape or form, you might be having to weigh or measure patients, think about all the different ways when we're actually looking at using our numeracy skills, our math skills across the modules and across your role and workplace. So obviously it is really good to actually have that opportunity to develop our maths and our numeracy skills and actually look at, are we happy? Do we want to do any kind of revision, and revisit some of these mathematical type issues that we might not have looked at for years and years and years since we were at school. Now, I'm not looking at doing in-depth algebra, there's no finding x's or anything like that. But what we are looking at is just our basic calculations, our basic formulations, and this will form part of the module alongside our medicines management. Now you might be sat there thinking, but I don't actually deal with medicines or giving out medicines or anything within my role. But one of the things that we're going to look at across this module, as well as looking at the underpinning theories and the underpinning legislations and things that actually help us within medicines management, but also actually how medicines and the tablets and the things that our patients might be taking actually might influence our role. Is a patient feeling a bit wobbly today because they have or haven't taken their medication? Has a patient been prescribed a new medication and this is now having an impact upon what we can do if we're working in therapies and trying to work with our patients, or if we're supporting our patients in other ways, could their medication actually be having an impact upon what is actually happening with them? You know, remember, we are looking at our patients holistically. We're looking at them as a whole person. We're not just necessarily looking at what we are there to treat or to support. So it is important really that when we think about our roles that we actually have an overarching kind of sense of who the patient is, what they are, what medications they're on, and how these might actually affect them. Especially important if we're actually going into our patients' homes. Again, even if we're not directly dealing with medication, if we see medications around, if we're looking at patients who are stockpiling, if we're looking at patients who might not be 100% clear on what their medications are, it's always good to have that underpinning knowledge to be able to support our patients and help them and kind of signpost them in the right place to go and get further information if they're struggling. So the learning outcomes of this module, by the end of the module you should be able to discuss and apply some of the basic pharmacology concepts. So we're going to be looking at, so when we take that tablet, what happens? So in the first year module we're going to look at a select few medications, and if you complete this and then move on to the second year medications module, we're going to look at a more specific kind of medications that you might come across more often within your own scope of practice. Whereas this year we're just going to look at some general medications that you might come across in everyday life, just to help us understand these basic pharmacological concepts and think about, you know, what actually happens when we take that tablet. How does it get from our mouth or through an injection site into the bloodstream and then to the place that it needs to affect? We're going to look at your knowledge and understanding of how medications are prescribed, administered and managed in healthcare, and then hopefully this can then apply to your knowledge and apply to your role place. As I said, it might not apply directly to your specific role, but it is really good to have this underpinning and to think about how this actually impacts your role as an assistant practitioner. So we're going to utilise formula and numerical approaches to calculate drug doses. So as I said, this is where our maths section comes in. This is where we need to actually be able to look at, you know, can we convert something from grams to milligrams, or milligrams to grams, or micrograms to milligrams? You know, thinking about, you know, if a patient is prescribed a medication, do we actually know how much they should be taking? Could we work out those different calculations if needed? We're also going to look at drip rate calculations and other calculations. Again, some of you might not come across these in your practice, and I know, you know, when we think about drip rates and things, we don't actually have to calculate these in real life these days. You know, we program it into an IVAC or the other type of electronic giving set type thing that are used within practice these days, and it does it all for you. But I know when I started training, we actually had to be able to work out if a bag of saline was prescribed over 6 hours, how many drips per minute should this patient be having, and we had to sit there and count drips. So it is something which is really useful. And again, it gives us that opportunity to use our numeracy skills in a way that's actually applicable to our practice potentially. And we can also look at identifying and applying the principles of safety in medicines management and administration. So again, we're going back to those legislations, we're going back to that underpinning theory as to why we do certain things within medicines management, what could happen, what might not happen, what some of the risk factors are around this, how we report things. Because again, we might not be giving out the medications, but we might be dealing with patients who've just started some new medication and are having weird and wonderful side effects. And that could be impacting the ability that you have to actually deliver your care or to support your patients or clients. So it is really important that we actually have this underpinning understanding and knowledge of medicines management within our role. So the sessions, so obviously we are working from home for this module. There I am again. So it is thinking, right, you are going to have to be independent learners for kind of chunks of this module. I am going to prepare all the information, and I'll look at over the next couple of slides how you can access this and the kind of information that I'll put across. But generally, obviously, apart from the first day when I have this 9 till 10 session, within a morning, between your 9 till 12 noon sessions, you will be expected to work through PowerPoints or other tasks and resources that I'm going to provide for you across Blackboard, Teams and the notebook, which I'm going to introduce later on, so that we can actually have a look at this. So I will be talking you over, like I am now, a couple of the modules, a couple of the PowerPoints, introducing things, making sure that you understand things. But then there'll also be some activities, the kind of activities that we might have done in class as small groups or teams. And we'll be looking at how we actually apply the knowledge and the theory that we've looked at and what this actually means for us. This might mean that the set tasks that you need to complete, you will need to complete within this morning session. I'm not going to give you more work than I would expect you to be able to complete within a morning session, within the 3 hours in a morning. Obviously our sessions do run now from 9 o'clock in the morning. We do have that full day. So you will be expected to produce or to be working on things for that full day. And you might be expected or required to upload your evidence, upload your tasks onto the Teams space. This will help you to form the basis of your notes. You know, think about if I'm asking you to create a particular thing, or to reflect on something, or to analyse an article, or to complete a table. These are also going to be your notes. These are going to be helpful as you go through the module and as you prepare for the assessment. But it's also by uploading your work into the Teams space, and I'll create specific folders for each of you. It's also going to evidence the fact that obviously you have been working, you have been fully using your 20% off the job for this particular week. So again, it helps me to be able to evidence this and to justify this when we're completing your apprenticeship. Then in the afternoon, between 1 and 2, we're going to have some group seminars. So within this 1 hour seminar, obviously I'll be going over the sessions and the resources that I gave you in the morning. We'll also be looking at discussions, feeding back from the tasks. So this is our opportunity to have a discussion as a group, to actually think about, you know, some of the questions or some of the things that we might have had brought up within our morning of looking and working through the resources. And just like the uploading of your work into Teams is going to form the basis for the evidence in a morning, your register from the afternoon seminar will also be forming this evidence of your 20% off the job training. 2 till 4, I will be available for one-to-one get-togethers. The group seminar can go on longer if we are having fun and we're into some interesting discussions. But those last couple of hours are either there for you to go back and to reflect upon things, or to finish anything that you didn't quite get finished in a morning, but also as an opportunity for you to catch up with me if you've got any questions, if you want any extra support or guidance or anything. So as it says, I think I'm cutting off a bit of the thing. The register and the evidence of the task completion is how we will record your attendance and engagement within this session. So when we think about our access to resources and other bits and pieces, obviously we will be using Blackboard and Teams, and I've created a Microsoft notebook for us. So announcements will come via emails through your UCLan email address. They might come through texts, again, that have been linked to your email account. But I'll probably be posting most announcements or any other information through our Teams group site, which is one of the channels within your March Teams page. So there is also information within the module handbook. So there's a timetable within the module handbook. The timetable's also on Teams, and it's within the notebook as well. And every week I'll be uploading session materials to both Blackboard and Teams, and there'll be additional resources and the tasks within our Microsoft notebook. I know most people these days, because we're so Teams orientated, tend to access Teams as their first port of call, which is why I will be uploading all the resources and things onto Teams as well, so that for those of you who use mobile tablets and things, who find it a bit of a faff to get onto Blackboard, you can access things directly through the Teams app. Within these places, there'll also be some other resources. We've got a pharmacology and drug administration workbook, which I will introduce in some later on sessions, and we'll be working through that as some of your tasks. We'll be looking at some numeracy and drug calculation practice worksheets again, as I said. Oh, excuse me. Numeracy and maths is going to form part of this module. It's one of the learning outcomes. So it is important that we practice these numeracy and drug calculations. So again, I'll give us lots of opportunities to be working on different calculations, looking at the formulas, looking at how we actually do some of these things and actually practicing them. And then obviously we'll have the reading list and resources. I'm going to introduce the Microsoft Notebook now. Now the Microsoft Notebook, I'll go into it in a lot more detail in the actual session between 9 and 10. So again, have a watch of that or have a play. But the Microsoft Notebook, which I've set up, is going to be a one-stop shop for any and all information that's going to be useful for you for this module. So within the notebook, I have different sections. We've got all the tasks, which will be assigned week by week. As I said, I'll also put the links to the PowerPoints and other resources. But we've also going to have all the resources that I feel are appropriate for each week that you can then click in and out of. So the first week, when we look at the information and the sessions that's going to be useful for our first week, so we're looking at legislations, we're looking at some of the underpinning theory, which is going to help us when we're thinking about medicines management. Now within the Teams notebook and the Microsoft Notebook, the links there and the links also on Microsoft Teams, I've put links to different websites, the RCN, the HCPC, the Department of Health, where all the key pieces of legislation or links to the key pieces of legislation lie. I've also put some links to specific little pieces of information and resources that have been developed by different people, like the Royal Pharmaceutical Society, the RCN, which are going to help you to say, right, so what is my role in medicines management? Now, all of these things might not be relevant to you personally, they might not be relevant to your role, but they will give you little tidbits of information on what these bigger pieces of legislation actually mean and how they're going to apply to you and support you within your practice. It's also going to form the basis of some of this morning's or today's tasks when we're looking at what some of these things are. I am going to go through the tasks and the information for today in the introduction in another video, so catch that later on. But check out the Microsoft Notebook. It will be updated on a weekly basis. There is an option, obviously I'll talk you through that in our session this morning when I do the introduction, but there is an option for you to actually be able to copy the notebook and then use it to make your own notes in as well. So it might be something that you want to use as your own personal note-taking facility. So we'll have a chat about that and I'll show you how to do all those bits and pieces. So obviously the bit that everybody cares about, how do we actually get assessed on this module? Now, for this module, it is actually an exam. Now, some people might be going, woohoo, exam, I don't have to write an assignment. And other people might be absolutely terrified of the prospect of an exam. Now, this exam is an unseen multiple choice online exam of 50 questions, of which you've got an hour and a half to complete it. Now, a lot of students from past groups that have completed this module have been a little bit worried about this exam. However, most of the marks that have been achieved through the exam have been absolutely phenomenal. So I wouldn't worry yourself too much. If you've worked through the tasks, if you've worked through the workbook, if you've come to the sessions, if you've done what's required of you and taken part in the mock exam and some of the practice questions and things, you should be absolutely fine with this exam. So please don't worry too much about it. There's 50 questions and the pass rate is 40%. So we're looking at about 20 questions for you to be able to get a pass mark correct. So hopefully you shouldn't feel too apprehensive about this. As I said, we will do lots and lots of preparation, lots of support, lots of guidance for this exam. So don't feel that I'm just going to dump you in it. We are going to have lots and lots of support for this exam. Because we are working online, we're working from home, we're not actually on campus, this exam will be done online. So you need to make sure that you've got a good computer device or tablet or whatever you're using that's got a good connection to the UCLan network, and you've got good Wi-Fi well in advance of the exam date. Now we will be looking at how we're going to take the exam. So if I look at this, we've got our exam, which is going to be on the 21st of October between 10 and 12. 12 a.m. No, not midnight. I've just realised I've made a mistake there. 12. Dinner time, not midnight. So obviously have a look at that. We've got that time blocked out. Obviously if you've got additional time, if you've got things that have been worked out for you, that's not a problem. We'll build that into the exam. But when we're thinking about our exam, it's between 10 o'clock in the morning and lunchtime on the 21st of October that we'll actually be completing this exam. We'll have a little bit of time to come together as a group just before the exam starts, and then you'll be completing the exam independently and individually. The exam will be completed in something called a lockdown browser. Now again, I'll talk us through that later on in the module, so you don't have to worry too much about it. But all it means is that when you start the exam, it actually stops you from being able to use Google and do other bits and pieces on your computer. So it just means that so you can't get distracted, so you can't Google the answers, while you're using that computer for your exam, it focuses you on just your exam. But as I said, we'll look at that in a lot more detail later on when we're setting up ready for the mock exam and things. We'll look at, can we all get it? How does it work? What do we have to do to actually access the lockdown browser? So please don't worry too much about that at all. So one of the questions that I'm going to kind of approach within the morning session is also going to be thinking about, you know, our apprenticeship standards. Which apprenticeship standards do we think that the module of medicines management are going to actually link to? So I want you to have a little bit of a think, you know, look at your apprenticeship standards. As I said, it might not necessarily link directly to your role. You might be thinking, what on earth am I on a medicines management module for? But have a look at and have a think about your apprenticeship standards, because actually when we think about a lot of the different things that we're going to cover within medicines management, the apprenticeship standards are going to link in quite nicely, even if it's not directly linked to your specific role. So we'll have further discussions on that later on. And then lastly but not leastly is our care certificate. So again, we all know that we've got to undertake our care certificate. Hopefully most of you have completed your care certificate through work. It might be something that you've done before you came on the course. It might be something that you're working on currently. But medicines management also links into standard 13 of the care certificate, that says that new workers must be able to describe the agreed ways of working in relation to medication and describe the agreed ways of working in relation to healthcare tasks. So again, when we're thinking about this, again, it might not be that we've got a direct role in medication or medications management, or we don't give medication out. But actually, when we're thinking about these things, we have to be aware of them. We have to be aware of these underpinning things to actually help us and to support us in our role. So these are things that are actually going to be key to help us progress. So it is really important that we do think about medicines management. So lastly but not leastly, here I am again. As I said, I'm going to be popping up all over the place. Um, any questions? Have a think. We're going to discuss them in the morning. We'll discuss them again at our afternoon sessions. You know, as I said, I do have that time set aside for you between 2 and 4. So again, if you want to ask a question, if you feel, oh, I don't want to ask it in front of everybody, you know, send me a message, send me a Teams, book in with me, ask if we can catch up. You know, we do have lots and lots of opportunities to get those answers, get that support, get that guidance. Please don't sit there and panic and think, I don't know what I'm doing. You know, ask me and I'll help the best I can. So I'm looking forward to seeing you all on Wednesday morning between 9 and 10. Obviously, if you're watching this after 9 and 10, I'm happy to have seen you all. Hi. And enjoy. And I hope you're all looking forward to this module. And I shall see you later. Bye.